Namaskar, Johar, and good evening to all my viewers and esteemed Foxians. Myself, Dr. Suman Sinha, Chairperson, Vaginal Surgery Committee, Fogsi, and your host for today's podcast. It gives me immense pleasure to welcome you all in the 209th episode of Gyan Pravah, a name that beautifully reflects our mission of continuous flow of knowledge. It's a celebration of shared knowledge, wisdom, through thought-provoking conversations and Foxi's unwavering dedication to academic excellence across borders, especially empowering mind and enriching women's healthcare with the aim Ek Rashtra, Ek Mission, Swasth Nari, Samruddh Vatan, Har Ghar Foxian. And now I take the absolute honor to introduce to you a remarkable personality who is not only a distinguished gynecologist but also an innovator, and his extensively impressive CV is filled with numerous accomplishments. On behalf of Fogsi and myself, I extend a very warm welcome to our today's guest faculty, Dr. R.M. Saragi sir. We are really honored to have you on the Fogsi platform. But before I delve further deep into the conversation, I'd like to make you aware about the evolvement of this podcast and Gyan Pravah. These podcast series is a prestigious initiative solely conceptualized and executed by our beloved visionary leader and unstoppable force in women's health, Dr. Sunita Tandulwadkar, who leads 46,000 strong federation with unparalleled purpose and compassion. She is globally acclaimed IVF specialist and endoscopic surgeon who transforms the impact of infertility care in India. She has the credit of delivering the first stem cell baby of India in 2018. She has pioneered ambition, which was nothing short of impossible. Her revolutionary Eagle project, impactful podcast series, and transformative Sampurna project on preconceptional care are all to empower women and elevate healthcare through action, science, and mentorship. Her Swasth Nari Abhiyan Yatra carries her mission to spread awareness for breast and cervical cancer from Kashmir to Kanyakumari. With her 18
This podcast is of you and Dr. Saragi.
One minute, madam. Just sir should also know.
Sir knows me.
With her 18 books, 85 publications, and more than hundreds of talks, she is the prolific academic voice with editor-in-chief of India's Journal of Endoscopy. Dear madam, we are eager to hear your pearls of wisdom. Please bless this podcast.
Thank you, Suman. Thank you for so many kind words you used for me. Thank you so much. But welcome, Dr. Saragi sir. You are highly respected, very dear friend for years and decades. And I'm so glad that Suman has chosen you as a faculty to be, having a podcast, having a dialogue, learning through the stories. I think self journey is what she has designed. And it will be great pleasure. So I join every day 8 p.m. just to welcome the faculty and to show the deep respect from the Fogsi president to the faculty. This Star Pravah series, I don't know, when I designed only keeping in mind my sweet chairpersons, 30 chairpersons, 30 days. I thought they will have a capacity to take the interview, they will learn leadership qualities, they will prepare themselves, what to be asked, whom to contact. And believe me, Dr. Saragi, this has become one of the best for me because I meet every day faculty of that level, maybe academic, non-academic, political, spiritual, philosophical. Oh my God, amazing personalities I'm meeting. And I think more than my girls, I got more evolved with every passing day. So today, I'm so happy that we are having you, and it will be enjoyable to have a discussion and to learn or to hear from everything. You are
Sunita, Sunita, before you depart, I would like to say a few words about you.
Okay.
Dear Sunita, if I were to use all 26 alphabets, I'll describe you as ambitious and affectionate. You are brave and broad-minded. You are charming and creative. You are dynamic and determined. You are emotional and energetic. You are friendly and frank. You are gentle and good. You are hardworking and honest. I'm going as per ABCD.
Yeah, we are.
You are intelligent and inventor. You are kind. You are loving and loyal. You are modest. You are neat and nice. You are optimistic. You are polite and practical. You are quite rational and resourceful. You are self-confident and sincere. You are thoughtful. At the same time, you are quite tough. You are understanding and versatile, and you are warm-hearted and witty. These words.
Thank you so much, sir. Thank you. Thank you so much. It means a lot because while writing down all these adjectives, you have probably kept me in your mind and in your prayers. So that means a lot to me.
Definitely.
That means a
Thank
lot.
you. Thanks a lot, Sunita.
Thank you, sir.
I'm so proud to have you as my Fogsi president.
Thank you. Yes, Suman. Now
Madam, I would like to introduce our Saraugi sir, and please do stay till I introduce.
Of course.
Thank you. So, Professor Dr. R.M. Saraugi is MD, FCPS, FICOG, and gold medalist all through PG and UG exams. A highly distinguished, focused, and immensely accomplished OB/GYN specialist with expertise in vaginal and urogyne surgeries from Mumbai. He has an illustrious career spanning over 5 decades. Presently, he is Director, Saraugi Group of Hospitals and Senior Consultant at Nanavati Hospital, Mumbai. Apart from that, he is Vice President, West Zone, Society of Vaginal Surgeons of India, and President, West Zone of SOFSI. He has the honor of being Professor Emeritus at SET GS Medical College and KM Hospital, Mumbai. He has been the postgraduate and undergraduate teacher and examiner all over India since the last 4 decades. He has contributed chapters in many books for PG and UG students. He has also written a book on HIV in pregnancy, which received Best Book Award by Fogsi in 2006. He is the recipient of the most prestigious Korean Award in 2007 for devising a surgery, mesplasty, for stress urinary incontinence in 2007. He has the credit of delivering more than 500 oral presentations, more than 100 publications in reputed journals. Currently, he has been bestowed with the prestigious Mox White Valor Award. Of his silent strength, selfless services, and compassionate support to fellow gynecologists in times of need, which is also the theme of my today's podcast, Selfless Journey of a Professor. Welcome again, sir, to this podcast.
Thank you.
Thank you. Thank you.
Thank you. And thank you once again before I leave, sir, my sincere, grateful that you came on a Fogsi platform today during our presidency, and you are one of the star faculty of our Gyan Pravah podcast series. I need to thank Suman for that. Thank you.
Thank you, Sunita.
Bye. Enjoy your podcast.
Thanks a lot.
So now we will go through the questions.
Yeah.
Sir, you have an illustrious career spanning over 5 decades in obs-gynae. Could you take us back to the early years? What inspired you to choose this specialty, obs-gynae?
Dear Suman, during my time, that was way back in 73, when I passed out my final MBBS exam, I topped in all the 3 subjects. And after topping in all 3 subjects, I had all the options of taking up anything, whatever I wanted. I chose gynec obstetric because it's very fascinating. A lady comes alone and lives with another child. That means 2 of them are living. Not only that, there is responsibility of 2 lives on doctor's head. What is more important is you are dealing with both medical as well as surgical problems. See, if you take up only medicine, then you are dealing with only medical. If you take up surgery, you are dealing with only surgery. Gynec obstetric is the only branch where you deal with medical as well as surgical branch. And there are so many challenges in it. That's the reason I thought of taking up gynec obstetrics.
Very well said, sir. Because it's such a gynecologist duty is so very precious, because the mother comes with within her, she has a child and she has so much confidence that if I go to this doctor, मेरा सब कुछ अच्छा हो जाएगा.
Correct, correct.
With that feeling they come to us. So it's really very good thing that you have chosen to become a gynecologist at that time, because at that time I think the maternal mortality rate was very
high, very high.
And somebody had to come to for this purpose, basically for this purpose. It was our government's vision also to bring down the maternal mortality rate, and since then we are fighting for it.
Correct.
So we come to the next question. Sir, we have come to know that you have topped in almost every academic exams you attempted, receiving numerous gold medals. What were the key factors?
Basically what happened, Suman, I am from a vernacular medium. I am from Hindi medium. I studied up to SSC in Hindi with a modest background. I was the eldest of 5 siblings. Aim was to work hard and excel in my life. Every result inspired me to do better. Whether it was SSC marks, inter-science marks, first MBBS, second MBBS, third MBBS, MD. In fact, I couldn't afford to buy a textbook also, and at Nair Hospital we had poor box fund. So I used to take books from poor box fund and use them, and next year I used to return those books back to the poor box fund. In fact, I'll go one step ahead and say that I saw a challenging case in the OPD or ward. I had to go back and read and help my patient. If I have seen a challenging case, I'll definitely go and read about it. I'll tell you my first intra-iliac ligation which I did. It occurred following post-MTP hemorrhage occurring in a nearby nursing home. And that gynecologist called me that, doctor, you come with a drum because I want to do a hysterectomy. My drum is not ready and please come and help me out. I went there, I did intra-iliac ligation on that patient and we saved the uterus. Not only that, the doctor came to give me some money afterwards, which I refused. And I said, no, I don't take money for these things. And after that, it started that I must help all my colleagues properly, because when I'll require their help, I don't know. That was the main reason I started thinking in those terms.
Sir, were you pushed by your parents to study hard?
No, my parents never pushed me for that. In fact, I went for ECFMG exam. In my time, it was ECFMG exam. In 74, I appeared for ECFMG exams and I topped at all India level.
Okay.
And that time I had all the options. In fact, I had few hospitals sending me letters with the mentioning that you decide the subject of your choice and we'll send you an air ticket also. But my parents were little against me going to USA for that reason. They felt that I am the eldest in the family, I should not go. And that was the only time they just said, no, you don't go. And I followed their instructions.
It was good only, sir, so that we had the opportunity to see you, sir.
Thank you, madam.
So from registrar to emeritus professor, you have held significant teaching positions for nearly 4 decades. How has medical education in obstetric and gynec evolved over those years? Do you find any changes, sir?
There are hell of a changes now. In olden days, whatever our teacher used to tell us, it was a gospel truth, nothing beyond that. However, now with vast era of information available, students have multiple modes of obtaining knowledge. The thing with me was, if I learned something or if my teacher has told me something, I will not stick to that. I used to think why this particular thing has occurred. And that why made me search through all possible books and journals to find out the reason. I'll give you a small example. Mechanism of labor, we talk about mechanism of labor only in human beings, not in animals. And why head is round. Nobody will think about these things. I went into detail about that. And look at the imagination of the God. We have mechanism of labor maybe because of upright position. But then at the same time, he made head round because biparatal diameter is 9.5 and suboccipitopragmatic is also 9.5. So it becomes a perfect round, something like a tennis ball, and with minimum surface tension, and that is why we deliver normally. So all these informations I used to get from different books by reading and going through the books. So my things never ended with whatever my teachers told me, but immediately I used to think why this is occurring. I'll go in detail about that and try and find out from the books.
That's very nice, sir. You have devised surgeries such as mesplasty for SUI and simplified hysterectomy steps. Can you share the journey of developing these techniques and their impact on clinical practice?
It's a very nice question. I'll tell you, Sumanji. Initially, TVT had just come, and we used to perform TVT, and invariably we found that it's a completely different surgery and a difficult surgery. Because afterwards you have to do a cystoscopy to find out whether you have not injured the bladder or not. Plus, cost was a major factor. What I went into detail about TVT was ultimately everything boils down to only one thing, that you have to keep a tension-free tape at mid-urethra. Because earlier our thinking was that probably SUI is caused due to problem at the internal urethral meatus. But once the theory was established that it is basically due to hypermobility of mid-urethra, and you have to keep a tension-free tape, I came out with my tape, and that was hernia tape. That means hernia mesh which is available, I cut it into about 20 pieces, 20. And I start 20 pieces, and they are, mind you, autoclavable. So the overall cost turns out to be only 50 rupees. So make a dissection in a regular way, small incision is made, and then you just put the hernia mesh in that area and just close the vagina. The basic advantage, no, you don't have to do anything. I've done more than 1,000 cases. I have given this topic to my residents who were my PG students. And let me tell you, over a period of almost 22 years, the success rate turns out to be 80%, which is equivalent to TVT and TOT.
No erosion, sir? Erosions?
No erosion, nothing, because the size of the mesh is about 3 to 5 centimeter only.
So 3 to 5 centimeter.
Okay. Yeah, lengthwise 3 to 5 centimeter, breadthwise about 2 centimeter.
Very small.
And even a first poster can do it. That's the beauty. And overall cost turns out to be 50 rupees, can be performed under local. And after putting the mesh, I used to fill the bladder and make the patient cough.
Okay. Just.
And in fact, this is there on my YouTube channel also. You'll find Dr. Sarogi's mesh plasty. It's worth seeing it.
Yes.
And worth performing it. That's the beauty of this surgery. And that made me feel, why not we simplify the things and make it easier, rather than spending 35,000 on that TVTO, TOTO tapes. Similarly with hysterectomy, what made me think about hysterectomy was, I thought that hysterectomy becomes little difficult because vaginal hysterectomy, you can understand, perhaps is easier, but NDVH was becoming difficult.
Yes.
Not many people were fond of doing NDVH. They were doing abdominal hysterectomy. Because our standard teaching was you have to put 3 clamps only. One is on uterosacral and Macken rods. Second one on the uterines and third one on the cornwall. I started teaching my residents, don't bother about the clamps. 3 is to be put, or 4 is to be put, or 5 is to put. Don't bother about timings. Go slow and start doing it, and let me tell you, now we can remove the uterus of almost 16 to 18 week size per vagina.
Stepwise surgery.
Stepwise surgery. There is no such rule that you have to go as per 3 clamps only. So that made me feel I should come up with this.
You got the Korean award for this mesplasty only, no?
Yeah, correct. I got that was given by Fogsi to me, and it was cash 75,000 rupees in 2007. That made a lot of difference.
It was such a happy moment for the whole, family, and even for the federation also, because receiving this award is not that's really.
In fact, I was given Ethicon Traveling Fellowship also for 40 days that I can go anywhere in India and work over there. They'll sponsor everything for me.
Must have been a very, I'm not
Foxy,
getting to words.
Foxy has been very kind to me, let me tell you.
Yes, you are such a personality, sir. Everybody will become fan of you. So, thank you, sir. So nicely you're dealing with the questions. And I think our viewers are also enjoying this podcast. We come to another questions. You were the first recipient of Mock's White Valor Award for selflessly helping colleagues in difficult surgeries for over 45 years. Sir, what drove you to this spirit of service? A little bit you have told us, but we want to hear from you.
Yeah, I'll tell you about this award. Let me thank Dr. Rajendra Sangpal, Mock's president, who thought of starting this award after 75 years of existence of Mock's. This award was given to me in the month of June 2025, and I was the first recipient of this award. In fact, my journey started 45 years back when I started my private practice. Nearby nursing home people used to call me to help them out in difficult situation when patient is on table with PPH or bleeding or something else. So I started helping them out, and in the bargain they used to tell me patient can pay only this much. Should I give you this or should I give you that much monetary? I said I don't want single naya paisa from you all. I have come here to help you out in difficult situation, and I'll continue to do that without any monetary gain. In fact, you will be surprised, I have traveled almost for 30 kilometers.
On your own? On
my own. I have left my OPD also in some cases and gone and helped the gynecologist out, because it's question of two lives. Question of life of the patient as well as of the gynecologist. Because imagine a medico-legal case being put on gynecologist, what will happen to the gynecologist? So I used to go help them out and come back. And this was selfless service which was going on all over Mumbai by me. In fact, I get every week at least 4 or 5 phone calls from my residents all over India. And they will talk to me on video also.
How to now,
abhi yahan tak aage kya kare?
Aage kya kare?
So that made me feel ki it's a selfless service. I should continue with that, and thankfully, Dr. Rajendra Sangpal realized that it's an important award and he thought of giving it to me. I am grateful to him for this. But when I started doing this, I never thought that it will be rewarded.
It shows your dedication and passion for this field.
Yeah.
And so it also shows that you are a very kind human being. You attach yourself to the patient. You feel every patient is yours.
No, what makes me feel that every time I have been called for some emergency, I got to learn something from there. My thinking was always that way. I learned something from here. In fact, you will be surprised. When I was at Cooper, my residents will call me up telling that fetal distress is there and we want to do a cesarean section on that patient. I'll say, go ahead. But next morning, I used to have a postmortem of that. In the sense, I'll say, okay, bring all the papers. We'll sit and discuss and try and find out how to avoid that section in next patient. Why this fetal distress occurred? Because fetal distress per se is not an indication for cesarean section as far as I am concerned. Fetal distress has occurred due to XYZ reason. So let's try and find out so that in next patient we avoid those factors which were responsible for fetal distress. And that is how my learning and my teaching was going on with the residents.
Wonderful, sir. Wonderful. Nowadays, these things are again coming because because our maternal mortality rate is not going down significantly. So now it's that why it's happening? What are the main causes? Why this maternal death occurred? So that is, there is a group of doctors, including government and this representatives of government, and they sit and do a board meeting, and then they try to find out the cause. And there is nothing bad about the surgeon who was involved in that surgery, but just to find out why this maternal death occurred and how to overcome this.
But madam, let me tell you, this postmortem which we do of doing a case is very important because that makes you learn how to avoid the problem in next patient.
Yes. Unless we don't do it, we will not understand and
we will not understand anything. Correct.
So, this Kerala people, the doctors from Kerala are regularly following this, but I don't think
very no, their maternal mortality rate has come down drastically in Kerala.
Yeah, it's in 2 digits, 18.
Yeah, it's too good. Maybe public education is also there. That may be one of the
public education. Yeah. In Jharkhand also, our maternal mortality rate is also going down. It's now 48, something like that. It is
good, excellent. We require all that now.
But our population is also the lowest of all these states, I think.
Yeah, I know.
So we move on to some other questions. Sir, you have conducted and operated in over 50 live surgical workshops across India. What do you think is the most valuable lesson for young surgeons during such trainings?
Madam, what is more important in this is what advice I can give to the young surgeon is hard work, sincerity, devoting, wanting to excel in every case, and self-improvement is very important. What is more important, they get a chance to see so many live surgeries. Nowadays, live surgeries are becoming little difficult, even video. Same operation being done by 5 different people. They'll get to learn so many things from that. Everyone does cesarean section, but cesarean section done by you, by me, by third person will be little different. So pick up all good things from that and go ahead with it. In fact, you will be surprised to know my cesarean patient goes home within less than 24 hours nowadays. Within less than 24 hours. They fight with me, in fact, why you are not sending me home, doctor, I'm perfectly normal. Less than 24 hours. I may be setting a record in city of Mumbai about it.
Yes, sir. Even in outside world, that is Singapore and all, my daughter was delivered in Hong Kong, and there they kept her for 2 days, 48 hours. Third day in the evening.
No, my patient leaves home within less than 24 hours.
That is marvelous. That is marvelous.
Yeah.
Patient goes home, huh?
Yes, 100%. They fight with me if I don't send them. Doctor, why aren't you sending me?
They can be of any background, low socioeconomic strata.
It's irrespective of anything. Irrespective, in fact, following any abdominal surgeries, except for Vardhams. Vardhams patient, I don't send them after 24 hours. I keep them for at least 3-4 days. But rest, all my abdominal surgery patients leave home within 24 hours.
Within 24 hours?
Yes,
And vaginal surgery?
yes. Vaginal surgery, because catheter is kept, I keep them for 2 days. Otherwise, all my abdominal surgery patient leaves home within 24 hours with guarantee.
One day I would like to see your surgery.
Yeah, I'll show you that.
Sometimes.
I don't use the instruments so much. I don't use forceps at all. Everything is with my hand. I believe only in one principle: respect the tissue and tissue will respect you. The problem with us is we don't learn how to respect the tissue. That is where the problem comes.
It's really amazing to hear from you, sir. Sir, you have authored more than 100 manuals and contributed to multiple textbooks. How important is academic writing for a practicing clinician, and from where do you find time, sir? We have only 24 hours.
I'll tell you, when I was head of the department at KEM and Cooper, I realized that residents were scared to stand in front of big crowd and give a talk, particularly in conferences. First poster, second poster, they were very scared. So what we started is, at Cooper we had 3 units. I was HOD. I made it compulsory that first Sunday of every month, first Sunday of every month, all of us will be present. We'll decide a topic in advance, and one unit will prepare that topic right from first poster till the boss. And there'll be a PPT presentation. Initially, we used to write on stencil and do it because PPTs were not available. Later on, we made it PPT presentation, and not only that, the others who were with other units, all the bosses and all the residents will come out with all possible questions and ask them the questions. This way, there used to be arguments, counter arguments. Literally, anybody outsider will feel ki why are we fighting? But let me tell you, those fighting days made us understand everything about that particular subject. And once it was over, next couple of days we used to convert it into a manual. And next seminar day, the manual was distributed free of charge to all the resident doctors. I still have those manuals with me. More than about 100 manuals we prepared, because more than 100 topics we covered.
Great, sir.
And that gave good confidence to all my residents to present paper, appear in the conferences, present videos and everything. They became expert in that. You will be surprised to know that once upon a time, everyone at KEM, all HODs at KEM were my students once upon a time.
Yes. Nice to know these things about you. In your experience, sir, how can senior doctors effectively mentor the next generation, balancing clinical exposure with ethical practice?
What is more important is, whenever a patient comes to you, be honest to yourself. Think that she is my relative, and how I would have treated my relative, same way I'm going to treat this patient. No unnecessary investigations, no unnecessary referral. Try and concentrate about the case, think about it, think positively, and it helps. You may start slow, have setbacks during your early days of practice. But let me tell you, once one patient is satisfied, he'll bring another 5 patients to you. Yes. I always believed in that principle, and let me tell you, I'm very happy about it. No cheating. Never cheat a patient. Second criteria was money should not be a criteria for patient to go back because I'm not doing surgery because money is the main thing. No, money was always secondary for me. So that instilled confidence into the patient, confidence into me, and I got all sorts of varieties of surgery which I could perform in my life. You name a surgery in gynec obstetric textbook and I have performed those surgeries in my life.
Sir, I would like to know from you which moment or recognition hold the most emotional value for you and why. Some incidents you remember of your time. You're
See,
emotionally attached to that scene.
I'll tell you, I'm emotionally attached to Association of Fellow Gynecs because this was something which I started way back in 1999. I'm the founder member of this. And why I started was there were 2-3 reasons behind it. One was MOGs used to have all the programs on city side. We were in suburbs.
Sure.
So it was fine. We were finding it difficult to go and attend all the programs for MOGs. Second was they were all attached to big institutes. So it was easier for them to manage the cases while we were in the small nursing homes having small problems of different types. So we felt that they are not interested in finding out our problems and solving our problems. Third thing which we made me feel was there used to be lots of infighting amongst all the gynecs in western suburb. If a patient has come to me, I'll talk something nonsense about the other gynec and patient will enjoy in that. So to get rid of all that, we started with a small group of about 8-10 people. We thought of meeting every week in someone's house or maybe in someone's hospital. Take up a topic, discuss about that topic, come out with some solutions. Then we started discussing about our cases, difficult cases. And then gradually the association grew and today we have a strength of 900 doctors under Association of Fellow Gynecs, only gynecs. Now with this, what has happened, there is a good harmony amongst all the gynecs. If someone is in a trouble, you will find 10 gynecs reaching there to help that person out. And that is why I was the one who named it as Association of Fellow Gynecologists. AFG name was given by...
Acha, AFG is your child.
Yeah, that's my child.
Sir, do you remember any sort of case which is still attached to you? You have ऐसा कुछ है क्या जो अभी तक आप याद करते हो?
I'll tell you. In the beginning of my practice,
yes, sir.
Suddenly a patient came in a collapsed state. And my nurse came and told me, I was staying in the hospital premises only. So nurse came and told me कि doctor साहब कोई आया है patient but in a collapsed state. She has delivered but she is in a collapsed state. So I said, what is happening to her? She said, pulse कुछ नहीं मिल रही है. And there is something, I really don't know. She said, there is something funny.
Sure.
Yeah, so I went and saw she was pulseless. Immediately we did a vivisection on the leg. Started IV fluid, then I examined her and it was inversion of the uterus.
Oh.
So I deposited that uterus. Within 10 minutes, I was surprised that she became normal. Same evening, she left my nursing home without paying even a single naya paisa, but I'll never forget that patient in my life who made me learn about inversion of uterus from her. I've never seen inversion of uterus before that in a collapsed state. But when I deposited the uterus, she became absolutely normal. So that is something which I'll never forget in my life. Yes, another patient which I came across was about 40 years back. We talk about PAS, placenta accretas syndrome. I came across an obese patient. I did a section on her and I realized that placenta is not coming out. I had not read about PAS in those days. 40 years back, I did not know about it. I did a hysterectomy on that patient because there was no other alternative. And later on, I started reading about it and I came to know that there is a condition like PAS, where placenta is adherent to the uterus and it bleeds because of partial separation. So these are 2-3 cases which I'll never forget in my life. When I talked about mesh plasty, first case which I did, I never slept whole night. I was tossing in my bed because I was wondering whether she will be able to pass urine or not in the morning because I had kept the catheter. Not only that, will SUI get corrected or not? I was more worried about that part. It's an unnecessary surgery. And let me tell you, when SUI got corrected next day morning after removing catheter, I was thrilled. So these are certain incidences which inspire you in life to do more and more for the patients.
Yes, sir. Yeah, I'm having goosebumps to know those things. So, again, I have one more question, sir.
Yeah.
With your vast experience and continuous engagement in the field of gynecology, what is your vision for the future of obstetricians and gynecologists in India over the next decade? How they should?
Suman, I really don't know why we are so much after Western world. I really don't know why we are so much after Western world. Because what is happening today is everything is whatever Western world tells us and we believe in that. The number of deliveries which we have is tremendous. The number of surgeries which we perform are tremendous. Why are we so much dependent on Western world for their figures? That's because we don't maintain our records properly. Look at Dr. Shirokar, look at Dr. B.N. Purandare, the way they came out with their surgeries. These are inspiring things for me. Why not we think about our own patient, our own ways of dealing with them, and come out with our own methods of operating on them? This is something which makes me feel that we are lacking in all these things, while Western world is too much ahead of us because of maintaining the records. They'll do 10 cases, but they'll maintain the record, while we'll do 100 cases, but without the records. So that is something which makes me feel that we should maintain record and we should publish our own data. See, no two human beings are alike on this earth. We Indians have different problems. Western people have different problems. So why can't we think in those terms and come out with our own data, our own methods, our own specification, our own method of doing surgeries? That is something which is very badly lacking in India, and that is something which is very badly required in India. That is what I feel.
Yes, sir. Yeah, this is a lesson for all of us, I think. Not only the newer generation, even we are lacking behind, and they should keep a register, a special register for it, and make the data about it.
Correct. I totally agree on that point.
Sir, with this, we come to the end of the question answer, and thoroughly
Thank you.
you have done very well, and you have made clear to all our queries. But some few things I want to ask, just fast questions, I can say.
Yeah, please go ahead.
So, sir, you are so busy practitioner. So, sir, do you get time for a family, sir?
See, I'll tell you, my family is my patient, my studies, my books, and my journals.
No, sir, I'm not talking about your own family.
I'm telling you this because today also I still attend my clinic, I still operate, I still continue to do everything. Luckily, my wife is a gynec, my son is a gynec, my daughter-in-law is a gynec, so it doesn't matter much to them now. They've also realized that he is a gone case, he is crazy after reading, and let him continue with that. In fact, a time will come when you'll come home, you'll realize my full book. You name a book and journal which I don't have. I still buy books, I still buy journals. And my one room is totally occupied with all these books and journals. So I'm crazy after reading.
How do you relax yourself, sir? What are the lighter moments?
Reading is my relaxation.
So you don't go to for a film, watching film?
No, I'm not very fond of movies. It's okay if my wife tells me that you should go for a movie, I'll go with her. I'll enjoy those 3 hours, but later on, if you ask me next day what movie did you see, I don't remember.
This is real sign of intellectuals.
I'm more interested in gynec obstetric, my studies, my work. I'm very keen on doing all these things.
Any special preference for any food, sir?
No, I'm a pure vegetarian. I don't eat eggs and cakes and pastries also.
In childhood?
Yeah, I have never tasted.
Never tasted. And your family, everybody? All of it?
Everyone else eats except me. I've never tasted alcohol. I've never smoked, nothing. I'm teetotaler.
And do you go with your family? These are all lighter questions, sir. Just
Yeah, please.
Sir, do you go with your family to certain places? Like people go abroad, people go to some other.
See what happens once in a while when they are insisting that come, Papa, come with us. I'll go. I'll never say no to them. I'll go there. I enjoy for 3 days, 4 days, 5 days, 7 days, maximum 7 days. Beyond that, I can't stay there. Then I think of coming back. I've visited all over the world, let me tell you. But probably for a week. Not beyond a week.
So it means you love traveling. At least one thing is possible.
Yeah. I don't mind traveling, but I'll go to a place where I'll go and stay there for a week, move around and then come back. Yes. Last year I was in Tokyo for about a week or 10 days. After that I went to UK for about 10 days. So I keep moving that way. But when it comes to conferences, I don't mind joining them.
So there also if there is any conference, you join.
Yeah, I'll join them. I've attended menopausal conferences. I've attended PPH conferences outside India. So all those things I've enjoyed.
Sir, it was really nice talking to you. We came to know so many things about your personality and we are really impressed. So thank you so much, sir, for being
Thank you, madam. Thanks a lot. Thank you.
With this, we end our conversation.
Sure.
Namaskar, pranam.
Thanks a lot. Thank you.